Hi there, my name is Dr. Judd Wattenbarger. I want to thank you for taking the time to watch this educational video. We're going to talk a little bit about some of the backstory and the reasons that we're speaking in the first place, because our goal today is to help identify and teach you some strategies that'll help you get long-lasting relief from the pain, the burning, the stabbing, the debilitating symptoms of peripheral neuropathy. Now, we always like to ask people, how would you like to feel? Would you like to be 50% better, 60% better, or more? What sort of things is the neuropathy getting in the way of in your life right now that you would like to improve? So, the first thing we'd like to do is ask, are you experiencing burning, tingling, numbness, even loss of balance? These are very common symptoms of peripheral neuropathy. In fact, after we're done today, you're going to understand the truth about the standard of care, what could be causing your pain, the documented dangers of neuropathy, proven methods for creating lasting relief, and of course, simple steps that you can take to get on the road to feeling good again. Most people that come to me are tired of taking medications. They're on 3, 4, 5, even more medications. In fact, a study recently told us that the average American senior is filling 9 to 13 prescriptions on a regular basis in a year. And what's happening? Is it making us healthier? No, we're actually seeing diabetes, heart disease, and neuropathy symptoms increase at an alarming rate, not like we've ever seen before, despite all of these medications that are being used. In fact, we're asked, how much do we spend on healthcare in the United States every year? Some people tell me 100 million, 500 million. It's $4.3 trillion. That's 4.3 trillion with a T. That's more than the budget of many countries. Now, with all of this expenditure on healthcare, would you think that we're the most healthy country in the world? I mean, that would kind of make sense, but it's not the case. In fact, the United States consumes 80%, that's 80% of the opioid medications produced worldwide, all right here in this country. And surprisingly, the United States only has about 4% of the world's population. It's interesting, we have the most doctors, the most hospitals, and we spend the most money, yet are we at the top? Nope. Are we in the top 10 of the healthiest countries in the world? No to that one as well. Turns out we are number 37 according to the World Health Organization. So we spend more money than anybody else, and we're number 37 in the world. Something is very wrong with our healthcare system. What's happening? Well, people are being sold directly, telling them that these medications are going to cure the symptoms that they have. We're being highly persuaded by these companies. There is $27 billion spent per year on marketing alone to sell these medications to the American public. Who are the most common ones, or the most common ones that we see, especially when we're talking about neuropathy? Well, the first one is Neurontin. Neurontin is a very common, also known as gabapentin. Its indicated use is for shingles and for anti-seizure. Now, it's used off-label for neuropathy symptoms a lot, but it's actually an anti-seizure medication. The warnings listed include driving impairment, dizziness, central nervous system depression, and risk of suicidal thoughts. Now, how does this actually work? Well, it reduces the excitability of the nerve cells. So it's basically blunting the cells or pulling a carpet over the problem. Another really common medication that we see is Lyrica, or pregabalin. Now, Lyrica was originally approved also as an anti-seizure medication. Common side effects of this one include dizziness, drowsiness, swelling in the hands and feet, trouble concentrating, increase in appetite, weight gain, dry mouth, blurred vision, and of course, all of these chemicals are still just covering the problem, not really fixing anything. So it's interesting when I talk to people, are we treating people worse, or are we treating ourselves worse than we would treat our cars? Well, let's think about it. What happens in your car when the check engine light comes on? Do you put a piece of tape over it? Do you ignore it? You just reset the light and call it good? No, you take it to the mechanic and you figure out what's wrong and you ask him or her to repair the vehicle for you. The problem is when the check engine light in our body comes on, we tend to ignore it. The numbness in the toe, the burning in the foot, the tingling in our hands, the restlessness at night, the loss of balance. These are all symptoms saying that your check engine light is on. Now, one of the things that we see when the check engine light is on is a symptom or a condition, called peripheral neuropathy. So let's actually let's decipher what this peripheral neuropathy actually means. Peripheral means away from the central nervous system, so arms, legs, hands, and feet. This is something that is from damage or disease affecting the nerves. Think about it this way. Our nerves have a coating on them, much like a household cord. If I had a lamp plugged into the wall, there'd be a nice, smooth, thick coating on the outside that protects that lamp. My light would then shine and bless the whole room with light, and we would see everything in the room. Now, if there's damage to the outside of that cord, if we were to strip some of that insulating layer off, the first thing that would happen is that cord would shock us as we move it, and our light would flicker. So we have miscommunication and misperception in the room. The same sort of thing happens in our bodies. The cord is broken, and so the light on the other side is not working the way that it should. Our nerves do the same thing. Our body and our brain are not communicating correctly. The problem is, neuropathies are quickly becoming one of the most common diseases in the United States. In fact, 8% of the United States population, or about 24 million people in the United States, suffer from peripheral neuropathy. It can occur at any age, but it is most common amongst older adults. 30% of those diagnoses are linked to diabetes, but not all. Some are poor microcirculation, toxic exposure, chemical exposure, or chemotherapy is a very common cause. Back, neck, herniated spine, herniated disc or spinal stenosis is another major cause. Post-surgery, some autoimmune issues, infections, alcohol abuse, liver and kidney disease, thyroid conditions, and there's many medications that can cause this. We also see a lot of frostbite here in this part of the country. That's also one of the causes that we see. There's roughly 100 causes of peripheral neuropathies. Now, what are the 7 most common warning signs? Well, the things we see the most often are certainly numbness, burning pain, cramping, sharp electrical pain, prickling or tingling, balance problems and falls, and the lack of sleep from foot pain. Now, why does this happen? There's different types of nerves carrying different types of signals. For instance, nerves that carry our balance sensation. When these nerves are damaged, it puts people at risk for falls and for injuries. In fact, 1 out of 3 adults over age 65 falls every single year. 1 in 3. 20 to 30% of these suffer severe injuries. 10% of these falls are fatal. The leading cause of injury death over age 65 is falling. So it's very important that we remain stable on our feet. Another thing that we see is sometimes people can't feel the world around them to the point that they sustain an injury, and they wind up losing a toe, a foot, or even part of their leg. In fact, amputations are so common in the United States. Each year, there's about 86,000 diabetic and neuropathy-related amputations. This is one of the most feared complications of this disease. Many patients are struck with a sense of hopelessness once they lose a limb. We see that on a daily basis, that people have lost toes and more. So, what are your choices? Do you just ignore it like the check engine light? Do you cover it with some medications? Well, there's options like that. Do nothing. Go to your doctor, get more medications, or get referred to a neurologist. Typically, when you go to a neurologist, there's going to be nerve testing performed, and they prescribe more medications. We see that over and over and over. People have been to their trusted provider, and they're told, you have a problem, there's nothing you can do about it, here's some more medications. And that's just not a good answer for us. We want more for our patients. Well, it turns out just living with it is a problem because this is a degenerative process. And the worse it gets, it will get worse faster. Some people say it starts a day a week, 2 days a week, and then it becomes more often, more prevalent, and more severe to the point that it becomes debilitating and affecting people's lives in an extremely negative way. But here's the good news. The National Institutes of Health tells us that peripheral nerves have the ability to regenerate as long as the underlying nerve cell has not been killed. So, when should you take action? Well, clearly as soon as possible. As long as that nerve cell is alive, there's hope. Now, I have to have the conversation regularly with people that we can't help them. They've waited too long. And that's one of the hardest conversations that we have. We want to make sure that you feel better, and it's important that you get after this before it's too late. So, there's 4 key steps to getting this whole thing turned around and getting you feeling better. First is to rejuvenate blood flow. Remember the cord analogy that we talked about? Well, the cord in our body is a sensory nerve. The sensory nerve is coated in a thing called a myelin sheath. Think of this as the insulating layer on a cord. This myelin sheath is covered in small blood vessels referred to as capillaries. The underlying problem is these capillaries die off because of all the causes we talked about a few minutes ago. The outside of the cord starts to wither and die, and we have miscommunication between the brain and the body. So our first job is to help restore that clean, clear, beautiful blood flow and help restore and regrow those blood vessels so that the outside of the nerve can heal. Think about putting the coating back on our cord. The second thing we do is we stimulate the nerves. We need to make sure that the brain and the body are speaking the same language. Think about if we were on a cell phone call and only getting every third or fourth word. That would be really frustrating. Well, our brain and our body are going through the same process. Problem is, you can't hang up on your body. So we have to retrain that communication. You're stimulating the nerve activation through some therapies in the body, and then of course teaching you how to stay well long term. So how do you increase blood flow? Well, one of the things that we use in our office is low-level light therapy. We found when you combine different kinds of light, different or specific red light as well as infrared light, the body does 2 things. It releases a chemical that grows new blood vessels. It's called nitric oxide. It also helps the body's energy mechanisms to work faster and more efficiently. That way, we're healing and we're growing. We use therapies in the office that are designed to help regrow the blood vessels and support the use of these low-level lights. Now, can we really do this? Can we really regrow these blood vessels? Turns out, absolutely yes. Light therapy was originally introduced by NASA. The design was to help speed up cell regeneration, especially in zero gravity. It turns out that when you don't have good gravity, astronauts would sustain damage and their bodies would not repair well. And so the scientists started using red and infrared LEDs, and they found that these wounds were healing substantially faster. Cells regenerated faster, blood flow was increased, new blood vessel growth was discovered, and healing was found over and over and over again. So back to our household cord. Again, what if we could recoat that cord? Well, now it's not going to shock me if I move the cord, and our light is going to shine brightly. There are therapies that we use in the office that help the body to move blood better, move tissues better, and help us to heal and really allow those nerves time and room to breathe. All of these put together are what gives us the therapies that help to reduce the symptoms and reverse this process. Some people have done a little bit here and a little bit there, but it's very important that all of these things are done at the same time so that your body is put in an optimal state of healing. Some people ask, why doesn't my doctor know about this? And that's an excellent question. It turns out it takes almost 17 years for any sort of research to go from the laboratory to the doctor's office. So many doctors have not even had the chance to discover this yet. Many times, the only education that they receive is from drug reps. And so they're unwilling or unable to teach the doctors about these therapies because they would sell less medications. Your doctor wants to know. In fact, we work with many doctors here in our own town that refer patients to us because they have seen that our methods are proven to reverse the symptoms that many doctors find frustrating, which is peripheral neuropathy. So, imagine for a moment with me that you're a good candidate for care. We don't know yet, of course. I hope we can help, but let's just imagine that you're a good candidate for care. Can you imagine what it would be like to sleep through the night peacefully? No tossing, no turning, no stabbing, no waking you up. What would it be like to walk with confidence again, knowing that your steps are steady and strong? How would you like to take trips, go hiking, walk your dog, spend time with your spouse or significant other, or get down on the floor and play with your grandkids? Just imagine what that would feel like in your life. What kind of change would it make in your day-to-day life if you could do the things that you want to do without restriction? So where do we go from here? Well, what we do from here is we spend some time sitting down in the office together. We'll go over your health history. We'll go over the things that are important to you. And if it's appropriate, we'll do an examination so we can discover whether or not our program is a good fit for you. Now remember, there's a number of symptoms that we see very commonly. And if you have any of these, it's very important that we talk. If you have numbness, burning pain, cramping, sharp electrical pain, prickling, tingling, balance problems, especially in falling, and you can't sleep from foot pain. We look forward to meeting you in the office so that we can spend some time together one-on-one and discover if what we do is right for you. We really hope that we can help, and we are very excited to meet you very soon.